color.
My temperature.
The temperature, I'm sorry. So the toes are cooler compared to the rest of the extremities. And then we have edema. Am I correct?
Yeah.
Okay. So assess edema on the dorsum. Okay. On the tibia.
Dorsum.
And on the behind the medial malleolus. Okay, so there is no edema noted. And then we assess the superficial veins. So you're able to see the superficial veins, okay? No varicosities. And then we assess the overall skin condition. So you have here some old scars. There's a small wound, okay? Maybe like it looks like an insect bite or something, and then he scratched it. The hair is sparse, but it's distributed throughout. When you have patients with arterial insufficiency, you will really see, like in this area, patch of baldness, and then you have,
Shiny.
and it's going to be shiny, and the skin's going to be stretched really tight. Okay, if you have more a venous incompetency, you'll have now a dusky or a brownish area here, like, you know, something like, can give you a better description of brownish, like a more hyperpigmented. It's not.
Diabetic patient tend to have a lot of that.
Or
Even those
arterial
with-
insufficiency?
I'm sorry.
Venous.
Arterial insufficiency?
No, venous.
Oh,
Venous.
And you have, and it's what they call this. It's not going to be very thick, but in patients with neurodermatitis, they also show that. Okay. Now, sometimes if it's a more severe type, like I said, you will see ulcers here by the ankle. Okay.
And the arseholes like kind of scaly,
Uh-huh.
really dry.
Yes, very dry, yes. Now look also at his nails, okay? They're not thick. You see the hair growth, you know. So that means he has good arterial flow to the toes. So you cannot
Good
have
circulation.
poor flow here and then good flow there.
So my hairy toes are normal.
Good for you. Okay. In women, like I said, it's harder to assess the skin condition on the legs because they shave, they're waxing all the time. So you can say, oh, there's no hair. Maybe she has arterial insufficiency.
Oh, wait, I
Okay.
have shave.
Venous insufficiency,
I
does
get
it almost
ashy.
look like bruising?
It's more brownish in color. Not a bruise is more like
Assess me.
bluish green. This one is more like brownish black,
It's not
depending on how severe the condition is.
I don't like shaving. It's
Okay.
weird.
Oh, well, a lot of women do. I have a student who shaves even her.
Ew, it grows
Upper.
in
And I go, really?
Then it
Mhm.
gets
Even in the winter.
Yeah, and then you're like,
Okay.
Make sure
And she has very fine hair, so I was wondering why she had to do that. Anyways, moving on. So we now go to the palpation of the different structures. Inguinal, you do not palpate, together with the femoral pulse. Okay. Then we have the popliteal. Popliteal. Wait a minute. Okay. Feel it. You have to push to be able to feel the pulse. His is really strong. You want to feel it? Push against.
I'll
Okay.
assess this side.
Okay.
Spring bending.
You should ask it. You should ask her. Wear your gloves.
Where's your glove?
Feel it?
Yeah.
I didn't wash my hands after the bathroom.
You feel it?
Kidding.
Sure.
Wait.
Oh, you have to press.
Am I hurting you? Ew, your knee was creaking.
Yes.
Good enough. You
Okay,
do?
I think I got it.
What do you think?
Yeah,
It's either you did, or you don't.
Let me check again. I'm having a hard time.
Here.
On this.
Oh, okay. You got it.
It's more lateral.
Oh, okay, I was pushing in the wrong area. That's straight ahead.
Okay.
I think you're dead.
Come here. Feel this. Next. we have the
my
dorsalis
pencil?
pedis. Okay, for the dorsalis pedis, okay, ask our patient, can you dorsiflex your foot a little? Okay, so it's going to be felt here. Ah, light, light.
Now we need gloves.
I'm not touching that.
Yeah,
It's a good practice.
It's good.
it is good practice.
Can you feel it?
I can feel it here. It's not going to be as strong as the pulses of the radial because these are smaller arteries. Light. What?
I guess we're pressing hard, that's why.
Medial malleolus.
I missed.
Oh, this one you can feel.
Oh, here.
Hmm.
Here. You gonna try?
Yeah.
Look at her wash her arm right away.
I don't know where his feet have been. He just went to the bathroom too.
I had shoes on.
Well,
No,
what about
no,
your
no, no.
socks?
Now you
Come
feel
on,
it
too.
there. Don't tell me you did it. You feel it, right?
Stop moving.
Sorry.
You feel it, right?
Have those pulses. Next, we now do our arterial insufficiency. Okay, so here, like we said, if let's say we have findings of, poor circulation, we ask the patient, can we help me? Okay, lift the foot about 6 to 12 inches away from the level of the heart.
I'm
Okay,
coming up with-
flap
How
For a
many
minute.
inches again?
6 to 12 inches away from the level of the
Okay,
heart.
so you have to
Flap,
flap for a minute.
Flap, flap, flap for a minute.
I feel the burn.
Flap more.
For 1 minute?
You're working your
Uh-huh.
calf now.
I know, I feel the burn.
Not the hands.
I know, I'm just-
Am I done yet? Okay.
Yeah.
Keep going.
But you look at his foot.
Yeah, I see the tail ends.
starting
Mm-hmm.
yellow.
white. Yeah.
No, look at that.
That's from the light.
So,
That's
Oh,
normal.
yeah.
The paleness.
yeah.
So it becomes very pale. And then you'll have to watch here because I'm going to ask him to sit up and dangle his foot. Okay. All right, Andy. Now sit up and dangle your foot. So, no move. See the quick return of the collar? Less than 10
Oh, wow.
seconds.
That's really
Oh,
cool.
less than
Mhm.
10
Oh my
seconds.
god.
See that return of the collar in less than 10 seconds. Okay, so that means there's good arterial flow to the extremity. Okay, next we do the venous insufficiency. Please lie down again. Now let's say, okay, like I said, this is done when you have a patient with varicose veins. Let's say this one is a varicose vein. It's not. Okay, so I press here. Okay, and then 5 to 8 inches above it, I feel for a pulse. Okay, so if there is a pulse that is felt, that means there is venous incompetency, or the valves are not working to prevent the backflow of blood.
So you shouldn't feel it.
You shouldn't be able to feel it, even if he has varicose veins.
Okay.
So that means it's a more severe type of varicosity. Okay, so that is for the venous incompetency. And then we now move to the auscultation of the arteries. So when we auscultate the arteries, okay. So again, we start with the aorta. Okay, so we said the aorta will be by the epigastric area, so here, a little towards the left. Okay, that will be your aortic. And we're trying to assess for broods. Okay, so we use the bell. Okay, and then on the right and left upper quadrants, are the renal arteries. And then right and left lower quadrants, you have the iliac arteries. No,
You shouldn't hear
no
it.
broods, I can hear his bowel sounds though. Okay, and then of course lower, you will have the right and left femoral arteries. Okay, so again, aortic, right and left renal arteries, right and left iliac arteries, right and left femoral arteries. Okay. Now, we forgot earlier the carotid artery. After the jugular vein. After the jugular
yeah.
vein. Okay. So, we need to auscultate first, because if we palpate before we auscultate, we will change the amplitude of the pulsation. So, we need to auscultate first. And, okay, so I'm just going back to that. Use again the bell. Do we apply it lightly or firmly on the patient's skin?
Lightly.
Okay, so take a deep breath, Andy, and hold. Okay, relax. Okay, now let's try it one more time. Take a deep breath and hold. Okay, relax. Okay, so no bruits are heard. And then we palpate. Okay. So they're equally strong. Amplitude is the same. Right. So these are our assessment for the heart. Any questions so far? The last part will be for the ECG. Okay. So for the ECG, okay, for purposes of the exam, okay, for purposes of the exam, for the ECG, you do it on a dummy. You just you stick the electrodes. Okay. You can use any of the dummies. Okay, and I would suggest that you prepare, put the supplies close to the dummy, so you will not be rushing, because all of this will be part of the 20 minutes. Okay, so with the ECG, but the rest of the skills will be on a person. It's only the ECG that will be done on the dummy. Okay. So these are your